one of the estheticians here at the Center PC. Today we are going to be doing a fan favorite, the HydraFacial, with a new addition. We do have two cool new perks that we're going to be adding on today. The eye and lip, so this is brand new to HydraFacial. These are add-ons that you can add with your HydraFacial purchase. They are individually $35. If you did them together, they are $65. If you wanted to come in and just do a perk and skip the HydraFacial altogether, they are $50 a piece.
Perfect.
And I will go over more of those in depth when we get to that step. So first today, after we have already cleansed our patient, we are going to start with some exfoliation. We will be using lactic acid to break up any dead skin on our patient's face, making it easier for the peel to eat it away.
And can you explain what a HydraFacial is?
So the HydraFacial is actually a 2-in-1 kind of facial. It is going to exfoliate your face mechanically and chemically. It uses a glycolic acid to exfoliate that dead skin. It's going to brighten your skin, and it's also going to help with any large pores that you might have. We also focus on anti-aging with HydraFacial. There are tons of antioxidants and peptides that will be infused as well. So it's a great overall deep cleaning for your face and an anti-aging facial all in one.
What does this acid do?
So the lactic acid is actually going to be breaking up all of the dead skin that is sitting right here on the surface of our patient's face. And in the next step, we will be using the actual chemical peel to eat this dead skin off.
Oops.
We're just gonna lay that acid all over her skin. And we're gonna loosen up all of that dead skin. You should feel little to no discomfort with this type of facial, especially this step. The next step that we are going to go into might feel a little bit tingly on the skin, but it's not going to leave you super red or peeling.
Perfect.
There are 3 different percentages that we can put you on with the glycolic acid. We always start our patients off with a 7.5%. It's the lowest you can go and the safest, so you'll feel little to no irritation on your face, but you will still get a good result. Right in the middle is a 15%. You may see a little bit more of redness with that one, maybe a little bit of flaking here and there, and it goes all the way up to a 30%, which is for those stronger patients that can tolerate it. You will have a little bit of peeling with that one.
If someone's on retinol, do they need to stop prior?
So, one question that typically does come up is if you are on a retinol previously at the time and you are coming in for a peel, you will want to stop the use of that about a week before and a week after. You might feel just a little bit of tingling with this. What this acid is doing is it is eating away at that dead skin on your face. It is correcting any large pores, so it will refine them for you. And it will also lighten your skin and help even out some of that pigmentation.
Who's a candidate for this?
So candidates for this type of facial would be almost anyone. The main thing that we try to stay away from would be cystic acne, more serious acne issues. You would want to get that under control before doing a HydraFacial. I'm going to let this acid absorb on her face, and then we're going to move on and do some extractions. So anything that might be sitting a little bit deeper in this patient's pores, we are going to suck up. How are you feeling right now? Any sensitivity or tingling?
Really minor tingling.
Perfect.
Minor, doesn't hurt. And the tool itself felt like a little suction.
Yeah, kind of like a vacuum.
But no pain or discomfort at all.
Perfect.
Okay, I have redness and spots. Does that help for that?
So with the HydraFacial, redness and spots do tend to be a concern. A quick fix for redness and HydraFacial would be possibly adding in the Resveratrol serum or the LED red light. That will also help with redness. You can add that on. I believe it's a $50 add-on to a service, and that will sit about 10 minutes, 5 minutes on your face, and that will help generally subside some of that redness. As far as pigmentation and brown spots, we also have a Brighten All and a new ZO Bright Alive serum, which is also going to help even out some of that uneven tone, pigment, sun damage to your skin. Moving on to the extraction portion. This is going to infuse a little bit of salicylic acid onto her skin. Salicylic acid is good for killing bacteria and keeping your skin nice and clean. So if you have any breakouts, this is going to be essential in clearing that. You can see how the skin does get a little bit pink. That is definitely normal. It generally goes down anywhere from 20 minutes to 2 hours after your service. Also, following your service, you do not want to exfoliate the face for about 2 days. You want to let that skin build up again. You also, again, will want to avoid any retinol, glycolic acid, salicylic acids for just a week following. You want to watch your sun exposure. If you're going to be outside in the sun or going on vacation, you might want to replan a peel, or at the very least, make sure that you are wearing a hat and reapplying your sunscreen every 2 hours to your face.
Someone wants to know if it's safe on pregnancy. Pregnancy? Yes.
So with HydraFacial, it is actually going to be safer with pregnancy. We would just probably opt to not do the peel.
So you would avoid, yes, last step.
Yeah, you would avoid the step previous to this one. We
Right.
would not do a chemical peel.
Got it.
You could absolutely get a nice, good, deep clean. Just making sure we have all of these pores clean.
What about makeup? Makeup.
So as far as makeup after the procedure, we want you to wait before applying at least 4 hours. You want to allow that peel to kind of sit and penetrate deep into your skin and start correcting. After the 4 hours, it will kind of self-neutralize on the skin. You're free to wash your face and apply makeup right after that. Some patients even will opt to sleep in their peel and wash their face the next day. So it's really just the patient's preference.
Okay, I have more questions. Do you see results after first treatment?
Results will vary person to person. Depending on what your specific issue might be will really determine whether or not how quickly you will see your results. Some do see great results after their first. Sometimes it will take a little bit longer if you're wanting to, if you have some of those deeper acne issues, or if you have some serious pigmentation, melasma going on, that might take just a little bit longer than one treatment.
You're going to see it in the canister. Yeah, you're going to see the results right away.
Yeah, you'll see the results right away. Actually, in our waste jar after the treatment, you can see some of those whiteheads and blackheads floating around in the little canister. So we'll definitely get to that as well.
One more. What about breastfeeding? Would the peel be okay?
I would probably stay away from any chemical peels if you were breastfeeding at the time, and I would do it as soon as you're done, just to be safe.
Perfect.
I'm going to clean my pen, and then we're going to neutralize this peel on her face. Actually, this is a new step, new protocol that we've learned with HydraFacial. We actually just had a huge training. apply them all around her face just to kind of neutralize some of that peel. This will also allow all of the peptides and antioxidants that we infuse next to penetrate even deeper into her skin.
So when you say later, that we can leave it on or wash it off later, so there will be product still on your face when you
Correct.
leave? Okay.
Correct.
And you just wash it with what? Soap and water or just water?
Just your normal cleanser, whatever you have at home to wash your face.
Not soap.
No.
Soap is not generally the best, but everyone has their preferences.
But just something that doesn't have any sort of,
Yes, no abrasive scrubs, I would
Okay.
say, nothing like that. No salicylic or lactic acid cleansers or anything
Okay.
like that. Very, very gentle, foamy cleansers for your face.
Which we have.
Yes, which we currently retail here at the Center PC. Next, I'm going to be using a booster serum for our client. I'm going to be using the Bright Alive Booster. She does have a few little sunspots, as you can see, right over here on her forehead, just a couple down here on the cheeks, right over in here. So we're going to help correct that today for her. You can also retail Bright Alive here at the office as well. And it can be used all over your body for any serious pigmentation issues you have.
Do you know the price point on that?
I want to say, I think it's 120.
It's like 120, 120 for Brighter Life.
Yeah. I want to say it's about 120 retail. We're gonna get right over here on her cheeks.
And most of our serums you can buy, like Growth Factor, Resveratrol.
Yeah. You can purchase Resveratrol, which would absolutely help with redness and rosacea skin, any sensitivity you have. I believe that one is,
It's in the
I
60s,
was
right?
going to say like 65, 66.
Growth Factor.
Growth factor as well. That is huge for tightening the skin and keeping you nice and hydrated.
It's 150.
That one retails for about 150.
Yeah.
So I'm just gonna rub in that serum. We're gonna get down on your neck as well. The next step is going to be antioxidants and protecting. So we will be infusing the Antiox Plus now. This has a combination of antioxidants that will be going onto your skin to help protect your natural barrier and keep you hydrated, as well as a little bit of hyaluronic acid, also to just keep any fine lines plumped. Bring that down on her neck as well.
I'm noticing fine lines around my lips. Would this work for that?
So, this would generally help with some of those fine lines around your lips. It's not going to be permanent or immediate, but one thing that is going to help would actually be the new HydraFacial Lip Perk. That would be huge for you. I'm actually going to be using this on our client right now, so I will show you the setup of that. You actually get an in-office treatment with this and a take-home, so you get it all to yourself. It looks just like this. It's a nice serum, and it has a roller ball technology on there, nice and cold. It's going to exfoliate the lips with peppermint extract and peony extract. It's also going to help keep your lips slightly plumped and hydrated. So this is going to be huge for that. We also have the eye replenishing serum as well. This one has horse chestnut seed extract in there, which is a huge antioxidant. So that is going to help tighten and refresh the eyes, as well as arnica flower extract as well, which is going to brighten your under eyes. So we're going to start with the lip. I'm going to go ahead and flip my switch over to the new perk. Turn my suction down to about 11 for the lips. And we're going to get started. So any dry and dead skin that you might have on your lips, this is definitely going to take care of that, as well as giving you a nice plumped appearance. You can already immediately start to see some of that plumping on her bottom lip in here. We're going to do a little bit more. How long does it last? The serum should last you about a month when you take it home. So it's actually huge. And again, you guys can already immediately see some of that plumping done. I'm going to do one more across the bottom.
You said you're going to have a DSL lips like my podcast.
I was thinking that.
Perfect. Beautiful. So you're about half done. This should last you about a month. Actually, I'm going to put a little bit on
How does it feel?
It feels good. It's cool.
there. Yeah, very cold and cool. And it's not sticky like a normal chapstick, which is what
Right.
I love about it.
It's a little, it tingles a little bit, but definitely doesn't, it doesn't hurt, just tingles.
Next, I'm going to get set up for the eye perk. I'm going to lower the suction on this one to about 7.
Yeah, I don't want plumping under my eyes.
Yes, no. This is going to refresh and brighten.
How long will this last? The eyes. The eyes.
The eyes? The
Yeah.
eyes should last about the same.
Month. Okay.
About a month, give or take.
Okay.
If you're using it twice a day, maybe a little less. But if you're using it just morning and something else at the night, it should probably last you about a month.
Okay. Perfect.
So with this one, I'm doing short strokes and dabbing. We're gonna rub that in. Gonna come up. Feeling okay?
Mm-hmm.
Perfect. So we're moving all around her orbital bone. Perfect. All right, my dear. And about half with this one as well, as you can see. Should have a nice take home with this. So I'm going to finish you off with some sunscreen and some new products that we have. We just started retailing our new Colorescience line. So Colorescience, I'm going to talk to you a little bit about, is a huge line that we have just started to carry. The first product that I'm going to be using on our patient today is called Even Up. This has an SPF of 50. It also has some active ingredients in here, which are going to be zinc oxide and titanium dioxide. So with this, it is going to immediately correct some of her uneven tone, the brown spots on her face, and even some of that redness that she has in her skin. So I'm going to be warming this serum up. You can immediately start to see.
And explain that this is the technique you use to put this
So
on.
this is actually the specific technique that you would use to actually apply this. You want to make sure that you are warming up those active ingredients and minerals in the product. And you want to press and roll onto the skin for even application. You'll use 1 to 2 pumps. And it is actually safe to use right after a peel, a laser treatment, anything intense.
Pregnancy.
Pregnancy, yeah. It's safe for that as well. I'm also going to be using the Total Eye today as well. The total eye 3-in-1 is going to be huge. Number one, it has an SPF 35 in it already, which is almost unheard of. It has a special metal that we use, which is cold to the touch, and it's going to help depuff right underneath those eyes. You need just a little bit. We're going to do one dot on her lid because it can be used all over the eye. It's going to brighten. I'm actually going to spread it. You want to always go away from the eye, not in towards it. That way you're doing a little bit of lymphatic drainage at the same time. And then we are just going to conceal her up.
Looks so good on her. I don't even need to wear makeup.
I know, like this could be completely used for foundation if you really wanted to wear it that way. And it already has SPF in it, so why not?
Mm-hmm.
Okay, my dear, the very last step and the last product I'm going to be talking to you about is the Sun Forgettable Brush Shield Protection. This is going to be huge. It is a little brush that you will apply all over your face. It's a powdered sunscreen, which is huge. So I'm going to show you how that works today. It comes in a few different shades. Today I am using the medium.
But normally you brush it on, but you're doing this for sanitary reasons.
Normally I would just brush this all over her face, but for sanitary reasons I'm going to be applying a different way today. We're just going to apply this all for the patient.
Perfect. And you want to show the canister?
Yeah. So she is all set. You can barely tell she even came in here and got an actual peel, which is awesome. That's what everybody wants to have. We're going to go ahead and take a look at the waste jar and see exactly what came out of our patient's face. I'm going to be using
I don't wanna
my
see the
handy
waste.
dandy flashlight over here.
Oh.
I'm going to shine this at the bottom.
I don't know
You
if
can
you
take
can
a
see.
look. Can you
Ooh.
see some of that?
I can, but I don't think you can see it.
My flashlight's going right there.
I don't know if you can see it from here at all.
Maybe from the side.
Lisa, you want to look in it?
Maybe my flashlight will work.
I can see something. Oh, yeah. Yep.
See some of those dead skin and those whiteheads and blackheads.
There it is.
Oh yeah, that's a good cleaning. Okay, so following your treatment, like I said, you'll just want to avoid any retinol for about a week at home. Watch your sun exposure. Make sure you're using your sunscreen. No exfoliating your face for a couple of days, and you should be good to go.
Price.
Oh, pricing. Pricing with the HydraFacial as of right now is $150, but we are actually going to be rolling in with some new packages for HydraFacial. We have 3 that will be rolling out, I believe, November 1st. So if you have been having the normal basic HydraFacial, it is going to be now called the Signature. It is a 30-minute hands-on treatment as well as this one, still all the same. You're getting a nice Derma Builder booster, which is a peptide booster to plump any fine lines on your face. And that one is $175.
Yes.
Going from there, we have the Deluxe, which is right in the middle, $225. You actually get a choice between the eye or lip perk. You get to pick any one of those. You also get a choice of the Derma Builder or Bright Alive booster, I believe. And you do get the Zeo brightening sheet mask as well as an add-on at the end of that one. That is 45 minutes hands-on. The Diamond HydraFacial is going to be our exclusive up there. It is an hour long, so about 60 minutes. With that one, you do get the choice again of the eye or lip perk. I do believe you get the choice of the growth factor booster, or you could still opt to choose a Bright Alive if you wanted, if you had any sunspots. We also get the Zeo brightening sheet mask, and you actually do get the LED light therapy with that one as well.
And how much are the perks again? Sorry.
The perks, let's go over that one more time. If you wanted to do these individually, let's say you come in and you're having your HydraFacial and you want to add on the eye, it would be $35 to add on just the eye. If you wanted to add them both on together, it's going to be $65. If you wanted to come in and just do a perk, just book for a perk and no HydraFacial at all, they are $50 individually.
Perfect. All right. I'm good if you're good.
Thank you guys so much for watching the service with me. Have a great Friday.